My name is Vicky, and I was diagnosed with coronary microvascular dysfunction. 11 years ago, I started experiencing symptoms like left chest pain that was very excruciating that radiated to my left arm, and it went up my jaw. Those symptoms, kept getting worse and worse throughout the years. It was very debilitating. It was 24/7. The pain would never go away. It would not go away with pain medications. I had shortness of breath. I was always very tired. I couldn't walk anymore. I was mostly bedridden for all those years. I thought most of the time I was going to have a heart attack. It was that severe. I'm telling my doctors that, I have no quality of life. Different doctors said that, it had nothing to do with my heart, that it was inflammation in the bone breast area. Some of them said that, it was my nerves. I was misdiagnosed with other illnesses. I felt like I was not being listened to. I felt that doctors were not taking me serious, and it made me feel so small. My results were coming up normal for a few years until a few years after an EKG finally showed up abnormal. But I knew my body, that something was wrong with me, and it was not just in my head. I had to be determined to advocate for myself. So I turned to the internet. I started to research left chest pain. At this time, Dr. Timothy Henry pops up. I followed my instinct. I picked up the phone and I called and I got an appointment. I brought all the test results that I was given. He kind of had an idea already of what was wrong with me. He said, I think you might have coronary microvascular dysfunction, but I need to make sure that that's what it is. I said, okay. I said, well, what do we have to do? He says, have you ever had an angiogram? I said, angiogram? Nobody ever offered that. He says, okay, I need to do an angiogram to confirm that this is what's wrong with you. He confirms it, CMD, coronary microvascular dysfunction, or CMD. Is the small arteries around the heart. Those supply blood to the muscle of the heart. Arteries were not functioning properly anymore. They were not supplying the blood that my muscle needed. I was so happy that finally someone had given me a diagnosis. Someone knew what was wrong with me. It wasn't in my head. I was not making it up. So the good news was that we had a diagnosis. The bad news was that there was no cure. I was very sad. I was devastated. I thought I was going to die. Dr. Timothy Henry said, there's no cure. However, I could give your name to my colleague, Dr. Barry Morse, who will be conducting a research in a few months. I could give her your name, and hopefully you'll be somebody that qualifies for that treatment. I had nothing to lose. Either, I stayed the way that I was living, which I didn't want to, or I took the chance and I met Dr. Barry Morse. She was fully aware of my misdiagnosis for so many years. She said that they were conducting research to hopefully inject those, our own stem cells into the small arteries around the heart. And that they were hoping that by injecting stem cells into the arteries, that the arteries will repair itself. So she explained to me that this had never been done. So when she told me that, I was like, what do you mean it's never been done? Which part has never been done? She said, well, we've never injected stem cells into the small arteries. I said, never? No. Okay, so are you telling me I'll be the first one? And she said, yes, you'll be the first person that we would inject the stem cells into the arteries. So I was very scared. I was petrified. I did not know if I wanted to do it or not. Dr. Barry Merce did, made it very clear to me that there was no promises of me being cured, that the stem cells, had been injected in other parts of the body and they had seen great results. And that they were hoping that it would do the same when they were injected in the arteries. So she never promised me anything, but they were hopeful. They were hoping that it would help people like me living with this disease. I knew clearly that there was no guarantees. Nothing was guaranteed. That it was a trial and that we would find out the results once we got them injected, once we went through the whole process and see how I would feel. I knew that it was a chance that I was willing to take, that I needed to take. I was hoping that it would at least allow me to take care of myself, or that it would give me, 1 or 2 years more of life. So once we started the trial, I went 5 consecutive days to the hospital every single morning to get numerous testings. I rested on the 6th day, and then on the 7th day, I got those stem cells injected into my arteries. They took care of me. They took care of my husband. They answered all questions. The support was amazing. I have no words to describe my gratitude for their love and their compassion to the whole team. When I get those cells injected throughout the days, I felt much better. It blew my expectations. I was able to walk now. I was able to get up by myself. I was able to bathe. I was able to come down the stairs without problems. I was doing a lot of things that I couldn't do before after I got those stem cells injected. The end results, it was all well worth it. I went through this trial and I would highly recommend this trial to anybody that has this disease. There's finally a treatment that could help you feel better, like it did with me.